So this article is titled "Quality of Life and Disease Severity Are Correlated in Patients with Atopic Dermatitis." So the article states that atopic dermatitis is a chronic skin illness that has gotten more prevalent in the past 30 years. Severe pruritus, or basically skin itching, is common in atopic dermatitis or eczema, and can result in sleep disruption and stress for patients and family members. The article refers to then to quality of life as a general concept to be able to tell whether a disease limits an individual's abilities to function and assesses the burden of the illness. Um, the article states that recently quality of life has become more useful for physicians to understand how a patient feels about their own illness and its effects on their daily life. The article says that although the disease is common, there is not a lot we know about how the severity of the disease corresponds to quality of life and if it greatly differs from the general population. Like many other articles, this article talks about the Dermatology Life Quality Index, and how it has questionnaires that are easy to use in clinical situations. This leads to the purpose of the study, which is to identify the impact of atopic dermatitis on the quality of life of children and adults, and then also identify the areas that are mostly affected by atopic dermatitis. So the areas in the quality of life that are most affected by atopic dermatitis. A second goal was to then guide appropriate treatment. The methods. The methods were, first, the quality of life assessments were done over a 6-month period on over 400 patients with atopic dermatitis. They were divided into groups of infants, children, and adults, adults being 16 and up, and infants being 3 and under. So, two scoring measurements of severity were used. One assessed the extent of severity, while another focused on intensity, like the current pruritus and sleep loss. So one is more short term and one is more long term. After scoring was assessed, then the questionnaires were distributed. There was a lot of statistical analysis that was used. Results. The variables that most negatively impact quality of life of infants were itching and scratching, mood, sleep loss, and then the lowest was problems that derived from treatments. The variables that most negatively impact the quality of life in children were also itching and scratching, sleep problems, but now also being embarrassed or self-conscious because of their skin. The lowest was bullying. For adults, then there was embarrassment or self-consciousness, itchy, like being sore and painful, and then preventing them from working or studying. And then the lowest was sexual problems and difficulties. So basically, the study showed that atopic dermatitis impaired quality of life did not vary by gender or age, that both long-term and short-term severity were taken into account, but however, these scoring systems, they didn't really reflect the sufferings of the daily life of the patients with the skin disease, and that also the condition of comorbid atopic dermatitis, which is like atopic dermatitis that comes with other diseases with it, like asthma and allergies, lowers quality of life more, obviously, because it brings more disease complications in and more symptoms that the patients with only atopic dermatitis have. And basically, this connects to my topic because it talks about the health-related quality of life in patients, but then it also talks about more self-perception in patients because of atopic dermatitis.